My name is Хоменко Владислава. I'm student of 5 year studying of Bogomolcя National Medical University.
I'm sorry, everything is okay. It's a little bit bad internet.
Okay, my topic of presentation is comparative evaluation and results of open and minimally invasive surgery of cardiac achalasia. Esophageal achalasia is a chronic benign severe neuromuscular disease characterized by functional obstruction of the esophageal gastric junction and decreased esophageal tone, which leads to progressive dysphagia and the development of a number of complications. For example, esophagitis, aspiration pneumonia, esophageal cancer, and cachexia. Esophageal achalasia is considered a relatively rare pathology. There are 1-2 causes per 100,000 population. Also, among the disease of esophagus is from 3 to 20% in the presence of dysphagia, takes the third place after cancer and scared affect person of working age from 20 to 50 years old, women more often than men. In rare causes, it occurs in children age 8 to 15 years old, and in the person over 50 years old. For the first time, the disease was described by Willis in 1679, who awaked spasmodic part of the esophagus with a veil mustache and bone sponge. The term esophageal achalasia was introduced for the clinic by Hartz in 1914. Barrett considered that esophageal achalasia a fatal disease because it caused many of his patient deaths. The most widespread are the classification, which are based on clinical and radiological and manometric features that allows you to determine the timing and extent of treatment required for this pathology. The most common clinical and anatomical classification in our country is Petrovsky classification, which distinguished 4 stages of this disease. Let us turn directly to the research. The research is based on the analysis of the direct and long-term results of treatment 103 patients with different stage of esophageal achalasia from 1983 to 2018. Patients were divided into 3 groups. The first group consisted of 53 patients who underwent open laparotomic esophagocardiomyotomy with fundoplication by Savinich in modification of famine. The second group consisted of 39 patients who underwent laparoscopic esophagocardiomyotomy. The third group consists of 11 patients who underwent balloon cardiodilatation and bowing. The purpose of research is to evaluate and to compare the direct and long-term results of open and minimally invasive operations with cardiac achalasia. General characteristic of patients. 103 patients were examined, exactly 55 women and 48 men with middle age 49.7. The duration of disease from 1 to 30 years. All patients were examined and divided by clinical stage of the disease according to the Petrovsky Fedorov classification. Esophageal achalasia of the first stage was diagnosed in 8 patients, the second stage in 24 patients, the third stage in 52 patients, the fourth stage in 19 patients. During examination, patient complained on complication and discomfort when they swallowed solid and liquid food. In 50 patients, the second-degree dysphagia was established. In 33 patients, the third-degree dysphagia. In 15 patients, the fourth-degree dysphagia was established. 92 patients suffered from second to third degree regurgitation, much less 7 patients first degree and 4 patients fourth degree regurgitation. 45 patients complain on heartburn, belching, and vomiting. Weight loss of more than from 5 to 15 kilograms was recorded in 17 patients, and middle of weight loss are 11 kilograms. 91 people were diagnosed with congestive esophagitis of varying degrees. During the patient survey, we identify some possible factor for the development of the disease. 53 patients indicate a possible stress factor in the development of the pathology. 36 people couldn't name the cause of the disease. Indications for the surgical treatment were stage 3-4 for the disease. In effect, it's in 66 patients, ineffective cardiodilatation or drug treatment in 24 patients, and stage 3 achalasia recurrence in 2 patients. One moment, I have problem with my presentation. In the mucous membrane, there are destructive necrotic change of the epithelium, compensatory basal hyperplasia, which is exacerbated by inflammatory leukocyte infiltration. You can see endoscopic picture of esophagitis in patients with esophageal achalasia. Sorry, I have some problem. Just one slide. You can see endoscopy with in patients with esophageal achalasia. Sorry. I have. You can see a schematic representation of the stage of surgery. Therefore, an open laparotomic esophagocardiomyotomy was performed for 59 patients. In 1 patient with stage 4 achalasia, a shunting esophageal intestinal anastomosis was performed. Laparoscopic esophagocardiomyotomy was performed for 16 patients according to the method described in Malinovsky's work. 18 patients underwent esophagocardiomyotomy with fundoplication by door. 50 patients underwent esophagocardiomyotomy with fundoplication by Taupet. You can see esophageal intestinal anastomosis. I said about it already. Let us check. Laparoscopic esophagocardiomyotomy was characterized with lower incidence of intraoperative complication, duration of surgery, intraoperative bleeding, dose of narcotic analgesics, and hospital stay. Intraoperative complication of esophagocardiomyotomy in laparotomy were perforation of esophageal mucosa in 6 patients and laparoscopy with fundoplication by Dora only in 1 patients. The perforation hole was sutured and cut a door foundation. From early postoperative complications, one patient of the first group, 1 patient after laparotomic esophagocardiomyotomy was with left side spontaneous pneumothorax with left lung attenuation and in one case, the supraponeurotic phlegmon of the anterior abdominal wall ligature fistula. See this information on my slide, but I say so sorry. The post-operative period processed successfully. There are no fatal causes. The duration of treatment of patient in hospital in the first group was 11.1 days. In the second group, 5.5 days. All patients of the first and second group achieved excellent and good direct results. The symptom of the breast pain disappeared in 69.8% and 58.9% of patients. Regurgitation 0.1%. Dysphagia in 52.8% and 41 point on the esophagus was achieved in all patients. Even with stage 4 disease, pathological gastrointestinal reflux was not observed. Long-term results of treatment include the next indicators. Post-operative period was continued well, and it was established for 732 days in the first group, 7 days in the second group, 31 in the third group. Recurrence of the disease is noted only in one patient of the third group and in 2 patients of the second group. The symptoms of dysphagia after 4 years was established in 48% of the first group, of 76.4% of the second group, and 54.5% of the third group. The symptoms of regurgitation after 4 years was observed in 32.6% of the first group, 69.2% of the second group, and 36.6% of the third group. Heartburn symptom after was noted in 34.6% of the second group, and in the third group 36.3%. 36.3%. We can observe the following conclusions. Laparoscopic esophageal cardiomyotomy allows to avoid intraoperative complication. Advanced technique of operation with fine frequency equipment provides fast, bloodless, and low traumatic execution of an extramucosal esophageal cardiomyotomy with subsequent esophagocardial fundoplication without imposition of a great number of sutures. Laparoscopic and open esophagocardiomyotomy leads up to positive results of treatment. On the first stage of esophageal achalasia, there is balloon cardiodilatation. On the second, fourth stage, there is laparoscopic and open esophagocardiomyotomy with fundoplication. Recurrence of the disease was only in 9.1% of patients. It required additional course of dilatation. It is better to use surgical treatment esophageal achalasia. Thank you for your attention. I'm sorry for my problem.
No problems. Thank you very much. Please, your questions.
May I ask a
Hello.
question, please?
Please.
I have a question, if that's okay.
Yes, of course.
Please.
I just want to ask, what was your role within this work, your specific role in doing this presentation, in this project?
Repeat, please.
What was your specific role within this project?
I have taken part in performing of operation. As it was open esophagocardiomastomy in clinical city hospital number 12. Number 12 on department surgery number 3 with academician Fomin and Professor Shipet. I observed some literature for this work, and I have taken anamnesis of patient.
Okay, thank you very much.
Hello, can you hear me?
Yeah.
Oh. Yes, so I want to ask you, what about the management of the complications after the surgery? Like in the complication you told about the perforation. So what will be the management and your prescription to the patient for their lifestyle or their diet or anything?
Here heard about complication. Yes, our patient had some complication, and this complication was decided by the of treatment pneumonia and sutured the perforation hole of esophagus. And sorry, I can't listen your questions. Can you repeat, please?
Yes, you heard right. I'm asking about the management of the complication and
You may
lifestyle
type,
and diet
yes, you may
change.
type in the chat.
Okay.
No.
There is kind of inflammation of the mucous membrane, and then it can lead to further complications. They must change their diet some period of time to prevent further complications.
No, the patients mustn't change their diet for prevent the complication, because this disease having etiology that is connected with diet. Are different factors. For example, congenital spasm of esophagus, stress factors, something, and some infection disease. But I I haven't some facts about connection this disease with diet of person.
Can I ask one question? How much patients were in your investigation with stage 4? And what kind of treatment for this patient?
With 4 stage in our research was
The stage more difficult for treatment, and the methods in your investigations, unfortunately, will
no,
result
1
for
minute.
stage 4.
With 4 stage was 19%, and for this percent was repeat, please.
What kind of treatment for patients with stage 4?
Surgical treatment.
What kind? Esophagocardiotomia only? In the world, in stage 4, esophagectomy often. And this treatment very esophagocardiotomia recurrence, and this treatment yes. Very often
patient
recurrence
with
after esophagocardiotomia by patients with stage 4. Understand? Thank you.
I hear you so bad, but you asked me why that after 4 stage that patient with 4 stage of disease have many recurrence. Yes, for this patient was performed laparoscopic esophagocardiotomy, and in patient with bad with comorbidities.
Thank you.
For example, cardiovascular disease or psychiatry, but mostly of person with 4 stage was performed laparoscopic.
Thank you.
So, dear jury and participants, that was our last presentation. So, thank you very much for your presentation. After